Hello and welcome to another episode of the HT Physio Quick Tips series. My name is Harlow and I'm the Over-Fifties specialist physiotherapist from HT Physio in Farnham. And today I'm going to be answering the question of why isn't knee surgery offered so often in the NHS anymore? Once upon a time, probably about 20 years ago, 15 years ago, it would be very, very common for you to have a knee problem, go and see your GP, and then for them to refer you straight through to go and see a surgeon. Now, many of the patients I speak to now are kind of a bit confused as to why that doesn't happen anymore, because for some of their friends and family, maybe they had a really good result when they had surgery this way. And some of them come to me and they say, is it just because the NHS is trying to save money? Now, I know everyone thinks that about the NHS, and sometimes it's true. But in this case, it's actually not the reason why knee surgery isn't offered so much. So one of the knee surgeries that was very commonly offered 15 or 20 years ago is something called an arthroscopy, which is where the surgeon will go in through a little keyhole and they will clean up the joint, take various bits of the cartilage out in order to help the knee function a bit better. Now, when this operation was first invented, it was like a revelation because it really helped people recover from knee injuries, and they were coming out of the operation and they could almost feel an instant improvement. Now, it went on this way for several years until we started to notice that many of the people who had had this keyhole operation several years later were actually getting worse than they were before they'd had the surgery. Now, the problem is, once someone's had this surgery, you can't undo it. So you can't repair what damage has been done. And it turns out that anytime you open up the knee, even through a keyhole, you disrupt some of the structures inside the knee, and that can lead to worse arthritis later in the future. From the studies that I'm aware of, although they report that people having arthroscopies get a rapid improvement after the surgery, they show that several years down the line, they actually end up worse off than they were compared to people who didn't have the surgery at all. And remember, many of the people who never had the surgery end up getting better on their own. So if you're someone who's a bit disappointed that you didn't get keyhole surgery and you thought that might be what was best for your knee, don't worry too much. If you haven't tried physiotherapy or other treatments like exercise and certain modifications to your lifestyle, that is always worth a try first. If you're one of the people who has had the keyhole surgery a few years ago and now you're noticing that your knee's painful again, try not to worry straight away. It might just be that there's a movement problem with your knee that can be addressed by someone who's well versed in identifying those types of problems. If you want a little bit more help with helping your knee pain at home and giving you some advice and exercises that you can get on with in the comfort of your own home, then one of the best places to start is to pick up a copy of my book, Thriving Beyond 50. And if you're in the Surrey or Farnham area, of course, you can feel free to give me a call on the office number or to take my free knee pain guide. And you can find the links for all of those things in the description. So I hope that answers some of your questions about why knee surgery isn't offered so frequently anymore. Personally, I think it's a good development, although it can sometimes be frustrating for people at the time. I think that overall we're getting better at treating these without needing to cut them open. Anyway, I hope this has helped, and I look forward to speaking to you on the next episode. Have a great Christmas if you're watching near the end of December.